My name is Mallory, and I'm out here on the ropes course here on the campus of Meridian to check in with y'all and talk about new things that are going on, concerns, resources, things like that. Unfortunately, Laura could not be here to film with me today, but there is something that I did want to talk to you all about. So what I want to talk about this week are substance use disorders and recovery from those disorders. So the first thing I want to talk about is the stigma behind substance use disorders. I hear a lot of people use labeling language when we talk about people that are struggling with a substance use problem. Labels like calling that person an alcoholic or an addict or a crackhead, right? And that makes it seem like they're a bad person, or it's their fault, or they're immoral, right? And none of those things are true, right? We really want to be careful about using stigmatizing language when we're talking about people who are really struggling with a substance use disorder, because substance use disorders are diseases. They are brain disorders, and we don't want to blame people for a disease that they have and that they can't help. Addiction is not something that you can just snap your fingers and get over the next day. It's something that takes treatment and therapy, medication sometimes. Sometimes it takes several attempts to quit before successfully quitting and going through recovery. So it takes a lot of support from family members and friends to be able to recover from a substance use disorder. So labeling and kind of blaming a person is something we really want to be careful about. Someone who is struggling with any disease, let's think about cancer, for example. What does that person need the most? They need support. They need support. They need someone not to judge them. They need someone to show empathy, to provide practical help, like maybe helping schedule an appointment, or taking them to an appointment, or bringing food and helping out that way. So I want us to imagine, helping someone out that who might be struggling with potentially a substance use disorder, helping them out in a way that you would help someone else out with with another disease like cancer or something. That's what they need. Just like any other disorder, they need help in that way. So let's say someone in your family or a friend of yours, let's say you're concerned about them. You think that they might be struggling with a substance use disorder, or you just have concerns that they may be drinking more than normal. How do you talk to that person? Well, I think approaching the person in a really non-judgmental way, not using accusatory language like, you really need to stop drinking that much, or why do you keep doing this, right? If it's a disease, treat it as though they can't help the symptoms that they're experiencing, and that's the truth. Say, hey, I'm really concerned about you. I have noticed this, and this. I've noticed you've been drinking a lot more, and I've noticed you've been really distant. Is there anything that's going on? I'm really concerned about you. Have you talked to anyone about this before? There are lots of professionals out there to help with these kinds of things, and I would be willing to help guide you in that direction. That kind of non-judgmental support is exactly what someone needs, and exactly what you can give to your friends and family members. And I also want to talk about, if you get to a point where you want to encourage someone to seek professional help, I want to talk a little bit about some of the programs that we have at Meridian and programs that you can look up in town. So as far as substance use treatment goes, we have lots of different options here at Meridian. We are a mental health facility, but also a substance use facility. We have outpatient services for people with substance use problems, and that's just, appointments where you show up to the appointment maybe for an hour, and then you go back home. We also have residential programs. So these are programs where someone would actually stay in-house for a certain amount of days through their recovery. So we have the Bridge House program, we have our MIST program, which is for new mothers who are going through recovery. We have the Recovery Center in Lake City for children. So those are all residential programs. We also have intensive outpatient therapy, which is more frequently occurring group therapy for people who are going through substance use recovery. So we have detox as well. So there are a lot of options, and I want you all to feel like you know those options and that you know of them, and you can help someone kind of find the best fit for them. So I think, you know, you could always give us a call, and we'd be happy to give you more information about our options for substance use treatment. But just know, you know, substance use is a disease. You know, talking to someone in a non-judgmental way, without labeling, without stigmatizing, is exactly what a person needs. And then knowing types of professional help that is out there can really help guide someone to success and to recover from their substance use disorder. So if you are interested in more information about our substance use programs, you can always give us a call at 352-374-5600. Thank you all, and we will see you next week.